Okay. Hi. First of all, I'm really glad to be back here. I really enjoyed visiting both San Francisco and Berkeley. It's really great. What I want to talk with you about today is something called Pervasive Healthcare. And I'll start actually by showing you this slide here. Because one of the first things you notice when you work with healthcare is that it's actually really different from office work or work in the office. The first thing you'll notice is that it's really collaborative. If you need to do anything within healthcare, you need to have multi-professions involved, and you need to really collaborate close with these people. The second thing you notice is that it's physical. You actually need to smell, you need to grab, you need to hold, you need to kind of use your body, use your senses doing the work. So it's not enough just sitting behind your desk working. You really need to use your body. Then it's also really mobile. We put a step counter on a nurse and found out that during a normal work shift, she was running between 7 and 10 miles during one normal work shift. So that might be another way of kind of improving the health of America. Turning them into nurses. A final aspect is that it's highly volatile. So even though you might have a booking system to plan all these things, in reality, the plans are changed all the time, and you have to adapt to these things. But again, if you look at some of the technology that is introduced into hospitals, and especially with the electronic medical record and patient record, what you do is you make small offices within the hospital. That is, you take the corner of the operating room, you put in a table, you put in a keyboard, a mouse, a computer screen for watching PACS images and lab results and stuff like that. You take the nurse's office and put in computer with the desktop, keyboards and mouses and stuff like that. And one of our claims is that this technology has been developed for an office environment, and it's actually not fitting being mobile, having to use your physical body and really have to work with the patients. So what we have worked with is a question about can we use novel invention within technology to provide better systems that provide a better match to some of the challenges within healthcare. So that is looking at novel interaction techniques, novel uses of sensors, and novel paradigms for using technology within hospitals. So I've summarized 3 main movements. Many of them have been covered during the conference. So the first one we'll see is home care. We'll see that more and more people are being treated at home, and we'll see more and more chronically ill patients being treated at home. The second thing is that we haven't talked that much about it during this conference, is that I think we'll see a lot more complex services within hospitals. Because if we're sending kind of the normal patient home, what's left in the hospitals are the severe ill patients, and it's acute patients. Another kind of movement, especially in Denmark, is that we are getting larger and larger units because the treatments are going to be more and more complex. So we need to kind of collect these complex treatments in larger units, larger hospitals. So that means we have much more complex services. And the third point I want to make is that we need new ways of developing systems for healthcare. Because to match this size in complexity, we really need some tools where we're able to iteratively involve the users and patients during the process. One of the things we've noticed during our work is if you ask doctors, nurses, patients what they want, they're often wrong. They don't know what they actually want. So if you ask them what they want and you, based on that, make a requirement specification, it's often misguiding. They'll be disappointed when you deliver the system based on this requirement specification. And one of the things we think we'll see in the future is a lot more iterative development, a lot more involvement of users. I'll briefly run through some of the projects I've been involved within these areas. So the first one about home care. When I visited Berkeley, we were looking at fall detection. How can you actually detect a fall based on different things? We had some sensors. We took them out to an elderly home in Sonoma, tried it out and stuff like that. And we found out that it's actually not that easy, and there's a lot of situation. I was following an elderly lady around, and suddenly the phone was ringing, and she had a walker, so she was going pretty much like this to catch the phone. And it's pretty much resembled kind of falling down the stairs or something like that. But again, it was a really interesting project, and I've talked to some people that think that the fall detection is just kind of the first step. So if you can make a segue that is able kind of to keep the balance, can you actually kind of combine the sensor values to kind of your balance and actually counter steer if someone is about to fall? So this is one project within the home care I've been working with. Then currently we're working on a project with pregnant women with diabetes, because if you have diabetes, there's a huge risk of miscarriage. So you really have to monitor your diabetes very carefully while being pregnant, and we've been working with that. Then we've worked together with IBM in Denmark with a project about elderly, where they were supposed to take the medicine, prompt about when to take the medicine, measure blood pressure, measure the weight and stuff like that. And it was installed in a number of elderly homes. It was based on a tablet PC that would prompt them when they had to take the medicine. And one of the things you realize when you get out in the wild is that sometimes this kind of tablet PC might be nice in the lab, but in an elderly home it's kind of not that nice. So the wife of this man kind of put a flower pot on top of the tablet PC to kind of make it to fit into this elderly home, which of course resulted in that this tablet PC went into a sleep mode and weren't able to kind of give the alarms. So again, it's not to say that this was a bad example. We saw a lot of things, and some of these elderly really got a better feeling of their own health, the relationship between the blood pressure and how they felt. But again, there's a lot of details you really have to pay attention to. Within services, within hospitals, I've been involved in a number of projects there. One of them we called active theater, and one of the things we looked at there was, can you actually dictate the medical record while you're performing surgery? So if you're having a surgery for 14 hours or something like that, instead of having to dictate the record after the surgery, can we use voice recognition and voice commands to capture video and pictures? So if you have removed something, you can say, I've removed a piece of meat with cancer in, and all the edges are okay and stuff like that, and the weight is such and such. We also worked with large displays with zoomable interfaces. So instead of this doctor having to move away from the patient, he could actually control the information from the place where he stood. A similar project we have in the hospitals. It's called the CITRIS Surgical. It's a commercial project right now, and it's about scheduling, because there's a lot of great booking system out there for scheduling operations. But the problem is that within the first hour, from 7 to 8 in the morning, something like that, the program is completely changed. They have kind of emergency acute patient coming in. There's a woman going to labor that is coming down. There is a doctor that turns out to be sick and stuff like that. So you constantly have to reorganize the program. And we've worked with the different new technologies within this project. So first of all, we worked with large interactive displays. One of the doctors we worked with said, if you're going to make me an IT system where I have to click once with the mouse, it's one time too many. I don't want to click anymore. I'm clicking too much already. So make me a system where I don't have to click. So we work with different visualization techniques to provide an overview without actually having to click to get this information. We worked with video streaming from the operating rooms, not to kind of do telemedicine, but to provide awareness information about what is going on in these operating rooms. We used chat that was actually really efficient between operating rooms and the patient wards and other stuff, because a lot of the phone calls weren't really necessary or acute or something. Can you take another patient at the end of the day? And chat actually provided a really, really good method for doing this kind of communication. We worked, of course, with mobile access to the data. We tracked the clinician, so you could see where the doctors were and what they were doing. And then we extended the communication infrastructure. So, of course, you had the phone to call the people if it was kind of really, really acute. But again, if you needed to chat with a person, then you could do it, and you could kind of see what was going on in the different operating rooms through the video and through the program. And then again, we started out actually wanting to build a system for the operating ward, but what it turned out to be was everyone in the hospitals were interested in these kind of informations, and especially a department like the central sterile department actually really needed this information because they were the one actually preparing all the equipment, and for them it was really necessary to know as soon as someone changed the schedule that they had to adapt to these changes. And they also felt that kind of being in the loop made them kind of part of the hospitals instead of being somewhere in the basement somewhere. So this system is currently running in 14 operating rooms in the hospitals in Denmark. Then the third thing I want to point out is we really need to have design methods where we involve the end user, and it's the doctors, it's the nurses, and it's the patients. Because again, especially if we work for Facebook, then we are pretty much the users we're designing for. But when we work for healthcare, we're designing for someone we don't even know how they live. None of the designers of technology are above 80 years old or something like that, or know what it's like to handle their medicine and having to take all these pills or being in a hospital. So we really need to kind of, as soon as we have a new idea, get some feedback from the users. And also work in multidisciplinary teams, because we can really learn a lot from game designers, industrial designers, like we just saw, or anthropologists or other people. And it's also really challenging to work with them. And just to make a point, if you look at the hearing aids, they're really stigmatizing, and they're trying to make them kind of as discreet as possible. But if you look at the top, if you are having kind of 2 wires hanging out your ear, then you're suddenly cool, then you're suddenly kind of a fashion statement. So again, just trying to grasp these kind of different stuff, and even though you're elderly, you're still pretty aware about how you look, and you don't want to run around with a big button saying, hey, I'm in the danger of falling all the time, so I have to run around with this big red button so I can press it. So you really need to pay attention to the people you're designing for, and really need some people who are good at understanding what these people need. So just to summarize it, some of the trends I see within healthcare, or at least I've selected for this talk, is home care. And I think what we'll see is sensors and actuators. We'll see them bodily implanted, and we'll see them in the environment. But we have to be really careful about how we're doing it. Because I don't want to live in a home where everyone else knows what is going on beside myself. You really need to be aware about privacy and these issues. Then I think we'll see a lot of specialized service robots. I don't think we'll kind of see the androids robots, but I think we'll see a lot of robots like the Roomba for cleaning the toilets, cleaning the floors, maybe helping the patient take a shower, moving them around in the middle of the night and stuff like that. I think we'll see some specialized service robots. Complex service in hospitals. What I'm working on is redesigning computing to match some of these requirements I mentioned in the beginning within healthcare. We'll see more patients being treated remotely, and that also means that we have to design hospitals in another way if half of our patients are not actually physical there, but somewhere else. Then we'll see more acute and severe ill patients. And then we need to involve the patient and clinicians in the development. And finally, some of the other trends we have seen here is we need standards for exchanging information between systems, and there's a lot of gain within biology, nanotechnology, gene therapy, and these areas. But that's not my main area. And if you want to know more about the project, there's research papers about all of them. So thank you very much. Yeah, good. Great.